Today, we will talk about a very important gut disorder. And before discussing this, let me ask you a question. Do you often have stomach pain, bloating, or sudden diarrhea, but all your tests come normal? It might not be the weak stomach. It could be something called the IBS, which is the Irritable Bowel Syndrome. So, it comes to the concept of the IBS. The first important thing is that the IBS is not the inflammatory bowel disease. It is actually the irritable bowel syndrome. So, the IBS is a functional gut problem. That means that your gut looks normal in the test, but it does not work normally. So, it's not damage, no cancer, and no infection in case of IBS. It's more likely a miscommunication between the brain and the gut. So before going to the topic, we will just shortly discuss the differences and the different points between the IBS and the IBD. So the IBS, as we have told already, that IBS is not actually the inflammation, and there are only the symptoms. And in the case of the inflammatory bowel disease, there is the gut inflammation plus bowel damage like the Crohn's disease or ulcerative colitis. So now we'll discuss the how is IBS diagnosed. So we'll discuss the room criteria. In this case, doctors don't have a single blood test for IBS. They use something called the room criteria. Simple meaning that recurrent abdominal pain at least 1 day per week for 3 months plus two of the followings. First, pain related to the passing stool, change in the stool frequency, and change in the stool from hard or loose. So basically, long-term abdominal pain plus bowel habit change plus the normal test is equal to the irritable bowel syndrome. So there are three types of the IBS. The first one is the diarrhea dominant, and the second one is the constipation dominant, and third type of IBS is the mixed type. Patients sometimes present with the diarrhea and sometimes present with the constipation. So now we'll discuss about the causes of the IBS. Exact cause is not fully known, but main triggers are the stress and anxiety, which are the very important factors for the IBS. Sensitive gut nerves, abnormal gut movement, food triggers, including the spicy, oily, dairy in some people. After gut infection, post-infectious inflammatory, the irritable bowel syndrome may occur. So it's not one disease cause. It's more like gut over reactivity. So the complications of the IBS include poor quality of life, anxiety and stress, work study disturbance, nutrition imbalance if that become restricted. But important thing is that it does not lead to cancer or any permanent gut damage. We'll talk about the simple management steps. The step one is the lifestyle modification. So reduce stress, which is the biggest trigger in this case. Sleep properly, regular exercise, even walking helps it. Step two is the diet changes. Avoid trigger foods such as the spicy, oily, caffeine. Some people improve with the low FODMAP diet, which including the FODMAP, actually in these are the fermentable oligo dimonosaccharides and the polyols, types of the carbohydrates that are poorly absorbed in the gut. Foods including the onions, garlic, beans, lentils, milk, apples, and the artificial sweeteners like the sorbitol. So eat smaller meals that will help you to overcome the problem with the IBS. So in the step three, we will control the symptoms through the medications. So the antispasmodic drugs can be used for pain, and the laxatives for the constipation, and the antidiarrheal drugs for the diarrhea in this case. And the probiotics in some cases can be used. So in the fourth step, the psychological support is important. Cognitive behavioral therapy at the counseling of the stress is high because gut and the brain are strongly connected in the IBS. IBS is not dangerous, but it can seriously affect our life. The good news is that with lifestyle changes, most people get control over it. So this was all about the risk factor, the complication, and management of the irritable bowel syndrome.